Hi, this is Dr. Warden. I wanted to review some implant surgery post-op instructions. First, make sure you review the dental surgery post-op instructions, the video and the written instructions, because that will apply for any of the surgeries. I just want to give you some extra information as applies to implants. Implant surgery can be done where we take a tooth out and place an implant immediately, or it can be done after the wound is healed. So we'll start with a healed site where basically we make an incision along the gum line, reflect that back, and then we make a hole in the bone, place the implant. But I can close the gums back together as they were before the surgery. We'll sew those together. That wound's going to heal very uneventfully most of the time. The main thing is your diet, nothing hard like chips, nuts, seeds, granola, anything hard that could get stuck in the wound. We want to avoid that at least for a week to 10 days, which is when we'll have you come back. I'll evaluate the wound and then we'll take out sutures if everything looks the way I expect. So those are pretty uneventful, and there are other dental instructions, and the dental surgery should cover the rest of that. With an immediate placement, it's a little bit different because there's a gap around the implant itself, and the wound doesn't come, the gums don't come all the way together because there's a hole where the tooth once was. So we place a bone graft around an implant to fill the void of where your natural bone is and where the implant is. There's a gap there. So we fill the gap with a bone particulate. We want that to stay in there. We don't want that to come out. So the main thing is swish real vigorously. We don't want a lot of negative pressure in there. We don't want to brush directly on that wound for at least a week. But we're trying to keep and maintain that bone in the socket itself. Sometimes I'll put a membrane over that, and I'll give you specific instructions before you leave on the type of membrane that we use. But in general, just avoid the wound. You're not trying to brush it. You're not trying to manage that so that wound that's delicate, the clot stays in place and things heal uneventfully. So other than that, with any incision line, we really don't want to stretch the tissue. So a lot of people want to see what it looks like, but even pulling on the lip and pulling that away, you can open that wound and you can either pull the tissue through the suture or the suture can come out. So we really don't recommend that you do a lot of stretching or pulling on the tissue. You may notice a few particulates that come out, some of the graft. We may lose 5% of that, and that's normal until the clot really contains all of that graft and that tissue starts forming over it. Some of that can come out. That's why I want you to be careful. But a few pieces, it's almost like big pieces of sand. We're not real worried about. Just gently rinse and spit those out. Like I said, in general, we'll take sutures out in 7 to 10 days, depending on the type of surgery. And anything else, please look at your written instructions for your implant surgery. Thanks.